Hello, my name is Fabiana. I'm going to be your nurse today.
Hi Fabiana, nice to meet you.
How are you doing today?
I'm good, and you?
I'm doing good, thank you. So I'm going to go ahead and use hand hygiene, and I'm going to make sure my environment is safe. I'm going to provide patient privacy for my patient, and I'm going to make sure that the bed level is at a correct level, and I'm going to make sure that the environment is safe overall. Okay, so then I'm going to go ahead and use a patient identifier, and I'm going to identify him with his name and his date of birth. And then I'm going to go ahead and ask him about his orientation. Do you know where you are?
Yeah, I'm in the hospital.
Do you know what day it is?
Yeah, today is 9th of January.
Okay, and do you know who the President of the United States is?
Yeah, it's Donald Trump.
Perfect. Do you have any allergies?
No,
Do you have any pain right now?
no.
Perfect. So I'm going to go ahead and do a head to toe assessment, okay?
Okay,
Okay. So I'm going to go ahead and start with his head. So I'm going to check the hair for any infestations and any abnormalities. And I'm going to check the face for symmetry. I'm going to check anything like a facial droop. I'm going to check the skin for any abnormal findings like redness, swelling, edema, or skin turgor. And then I'm going to go ahead and move on to the ears. So I'm going to check for any redness or swelling or drainage. Okay, and then I'm going to check his eyes. I'm going to inspect them. They look fine. I'm going to go ahead and check the nose. If there's any redness, drainage, or swelling. Okay, and then I'm going to check the lips. Everything looks good. So then I'm going to go ahead and move down to the trachea. And I'm going to just observe the skin. I'm going to observe if it's symmetric. I'm going to palpate the lymph nodes and make sure that nothing's abnormal. And I'm going to auscultate the carotid pulses. And I'm going to make sure that I auscultate the carotid pulses one by one and not at the same time, because you shouldn't do it bilaterally. Okay. So then I'm going to go ahead and inspect the jugular vein here and make sure that nothing abnormal is found. Okay. So then I'm going to go ahead and start to assess the cranial nerves. And I'm going to start with cranial nerve 1. And I'm going to go ahead and, which is going to be the olfactory nerve. So, give me 1 second here. Okay, let me grab something. Okay, so what does this smell like?
it smell alcohol.
Alcohol. So that means his olfactory nerve is working fine. And then I'm going to go ahead and assess cranial nerve number 2. Okay. Can you
Okay.
cover one eye? Can you read this number to me?
9-5.
Okay, so can you cover the other eye and read this number to me?
8-7-4.
Perfect, thank you. So after cranial nerve number 2, I'm gonna assess cranial nerve number 3, and I'm gonna go ahead and, which is gonna be cranial nerves 3, 4, and 6. So I'm gonna ask the patient to please follow this pen light with his eyes without moving his head. So can you follow this pen light with your eyes without moving your head?
Okay.
Perfect, okay? So then I'm going to go ahead and assess for Perla. And Perla, I'm going to go ahead and shine the light at his eyes, but he's not going to look directly at the light. He's going to look behind me. So can you look directly at the TV? And I'm just going to shine this toward your eye, okay?
Okay.
Okay, so his pupils are constricting with the light, meaning that his cranial nerves for his eyes are okay. Okay? So then I'm going to ask you to follow this light one more time, okay?
Okay.
Perfect, okay. So then after that, we're going to assess cranial nerve number 5 and 7. So cranial nerve number 5, I'm going to go ahead and ask him to open his mouth against my force. Okay, and then cranial nerve number 7, can you smile? Perfect. Okay, and now we're going to assess cranial nerves number 9, 10, and 12. So for number 9, we're gonna go ahead and ask the patient to open and say ah. And we're
Ah.
gonna assess the gag reflex. And then for cranial nerve number 10, can you swallow? Swallow. Perfect. Since he can talk and he can swallow, his cranial nerve number 10 is working fine. Then we're gonna assess cranial nerve number 12. Can you stick out your tongue and move it side to side? Perfect, so it's working good. And then for cranial nerve number 11, the trapezius muscle, can you shrug your shoulders? Force. Perfect. Okay, so then that's working fine. Okay, so now we're gonna move over to arms on the chest. So I'm gonna inspect his arms for anything that's abnormal. I'm gonna look for skin turgor, redness, edema, swelling on both arms. Okay, and then I'm gonna go ahead and ask my patient to lay down and take off your shirt, please.
Okay.
Okay, so after I'm done checking his arms, I'm gonna observe for respiratory expansion. Okay, and then I'm gonna observe the thoracic cage and I'm gonna make sure that it's symmetrical. And I wanna look for symmetry, anything that looks abnormal. And I'm gonna palpate very lightly. So I'm gonna go ahead and measure the brachial artery on one arm. And then I'm gonna measure the brachial artery on another arm. And then I'm gonna go ahead and assess the radial pulse on both arms. Okay, and then everything is looking good. So then after that, I'm gonna go ahead and begin auscultation of the chest. And I'm also gonna assess for range of motion when I'm assessing the arms and when I'm assessing the thoracic cage and the chest. So can you sit up, please? Okay. So I'm gonna go ahead, before I do that, I'm gonna go ahead and do the deep tendon reflex for the bicep. So he's gonna flex, and I'm just gonna test this out. And then for the other arm, I'm gonna test this out, okay? And then I'm gonna assess for the tricep deep tendon reflex. Okay. Okay, and then I'm gonna do the brachioradialis deep tendon reflex. Here, and it all sounds good. And then I'm gonna get ready to auscultate the valves of the heart. So before I auscultate, I'm gonna inspect the respiratory rate and make sure that it looks regular, make sure that there's no abnormal breathing, and I'm gonna make sure that like the apical pulse is gonna be 60 to 100 around there. Okay, so I'm first gonna start with the aortic valve. And then I'm gonna move forward with the pulmonic valve. And then I'm gonna do Erb's point. And then I'm gonna do the tricuspid. And then I'm gonna do the mitral valve. Okay? So everything seems to be listening in on fine. So after that, I'm gonna move on to the abdomen of my patient. So for this, I'm gonna ask my patient to lie down again. Okay. So before I move on to the abdomen, I wanna make sure that the capillary refill of his hands are good. So I'm gonna assess each finger and make sure that the blood is coming back at a reasonable timing. Less than 3 seconds. Okay. So when I arrive abdomen section, I'm gonna go ahead and I'm gonna inspect the abdomen. I'm gonna lightly palpate each quadrant to make sure that everything is fine. I'm gonna ask my patient about bowel movements. So, when was the last time you went to the bathroom?
This morning,
Okay, and how often do you go to the bathroom?
every 3 to 4 hours.
Okay, and what color is your urine?
Yellow?
Okay, and do you have any bladder problems?
No,
Okay,
nothing.
and do you have any signs or symptoms of a urinary tract infection?
No, nothing.
Okay, perfect. So he doesn't have signs of a urinary tract infection. He doesn't have bladder problems. He goes to the bathroom every 3 to 4 hours, and his urine, he says it's a yellow color. So after that, I'm going to also take the quadrants, all 4 quadrants. So I'm going to start at the right upper quadrant, and I'm listening for bowel movements. And then I'm going to move down to the right lower quadrant. And then I'm going to go up to the left upper quadrant. And I'm going to move down to the left lower quadrant. Okay? And everything there seems to be fine. Okay, so for this section, I'm going to ask my patient, can you please sit up? Okay. So also, when I'm auscultating the abdomen, I'm going to inspect and make sure that there's no skin turgor, hernias, lesions, anything that looks abnormal on the skin, any redness, edema, or swelling, so I can know, right? And when I am palpating the quadrants of my patient, he's gonna let me know if he feels pain in any quadrant, right? And if he does feel pain in any quadrant, that's gonna be the last quadrant that I'm going to try and palpate. So for the last part, I'm gonna go down to the lower extremities, and I'm gonna observe his legs for any scars, lesions, anything that looks abnormal, skin turgor, warmth, redness, or swelling, right? And then I'm gonna go ahead and test his deep tendon reflex, the patellar ones. So I'm gonna go ahead and do this. I'm gonna do this, make sure everything is fine. I'm gonna check for range of motion and strength, muscle strength, and configuration. And then I'm gonna go ahead and assess his duralis pedis pulse on both feet. Okay, and then the other pulse, the posterior tibialis one. And lastly, I'm going to check for capillary refill on his toes. Okay, so the blood comes back at a reasonable time, less than 3 seconds. Okay, and then last I'm going to do the Romberg test. So can you please stand up? Okay, can you close your eyes and put your hands forward? So here, I'm going to count to 30 seconds, and as I count to 30 seconds, I'm going to be assessing his balance, and that's what the Romberg test is. Okay, do you have any trouble walking?
No.
No? Do you need like a wheelchair? Do you need a cane?
No. Anything.
Okay, perfect. Thank you so much.
Thank you, nurse.